Welcome to this short presentation on OCT angiography. I'm Dr. Julie Rodman. It's my pleasure to share my experience and passion for this technology with you. In order to understand OCT angiography, you have to have a little bit of history behind where we have been with OCT and where we are now. In the early 2000s, time domain OCT was introduced. This was really huge in the field of optometry because for the first time, we were able to get a non-invasive visualization of the retinal structure. However, as you can see in the image, there's a lot of artifact, and there were a lot of questions about what was actually pathology and what was actually a real finding. So a couple of years later, in 2006, spectral domain OCT was introduced. And as you can see, the image quality is much advanced over what it was in the time domain OCT. However, it's important to remember that these technologies only show structure. They don't show the functionality of the blood vessel, of the nutrition of the vasculature going on in the eye. So the OCT companies in around 2014 introduced OCT angiography to fill this need in the market. They wanted a non-invasive way of visualizing retinal and choroidal blood flow. So as you can see, the angiography image looks quite different from what we're used to seeing on a regular spectral domain OCT. So just to summarize briefly, OCT is excellent at providing visualization of retinal and choroidal anatomy, but does not give us any information about blood flow or vasculature. And that's again where OCT angiography is going to come into play. How does OCT angiography work? It essentially uses motion contrast to detect blood flow. It looks at the movement of blood within a blood vessel and looks for differences between sequential B-scan images to assess for blood flow within the retina and choroid. As you can see on the left of this screen, there are two B-scan images. The machine looks at those two B-scan images and detects any differences in reflectivity between the two images. Any difference in reflectivity is essentially interpreted as blood flow. The image in the center shows the blood flow overlay image, which wherever you see red is an indication that there is blood flow. From that blood flow overlay image, angiography scans are created via en face or coronal cuts. So looking at the horizontal or en face cut will correlate with the level of retinal anatomy that you are looking at. So if you look at the retinal anatomy here, if you essentially cut through various sections of the retinal anatomy, that will show you where the angiogram is visualizing blood flow. The superficial plexus is going to image the most anterior part of the retina. The deep plexus is going to image more posterior than the superficial. Then you have your avascular zone, which is essentially your RPE and the surrounding tissue. And then you have your choriocapillaris, which is the most posterior structure. Anything white on the angiogram is going to indicate blood flow. Anything black shows no flow or areas of non-perfusion. When you're looking at intraretinal disease, things that OCT angiography are very useful for are things like diabetic retinopathy. Remember that diabetic retinopathy affects the inner retina, so we want to focus our attention on the superficial and deep capillary slabs or superficial and deep angiograms. As you can see on the bottom left, that is what the normal superficial and deep angiogram segments should look like. On the right, you can see what a patient with diabetes might look like. You can see an increase in the size of the foveolavascular zone, you can see areas of non-perfusion, and you can see microaneurysm formation. Here's a patient that looked clinically healthy on fundus exam and on OCT imaging, and she had a decent control of her blood sugar and A1C. However, OCT angiography gave a different picture. You can see that there are a lot of areas of non-perfusion, microaneurysms, and enlargement of the foveolavascular zone. So using OCT angiography allowed us to really take much better care of the patient than just using fundus exam and OCT imaging alone. There's also a capability of using quantitative software to analyze patients with diabetic eye disease. You can measure the size of the foveolavascular zone and compare it to patients of a normative database. You can also look at patients' foveolavascular zone over time to assess the stability of the condition. You can also use a color-coded vessel density map to assess the classification or status of the diabetic eye disease. OCT angiography is also useful for outer retinal disease, as in age-related macular degeneration, and we want to focus on the avascular and choriocapillaris slabs. Here's a patient that has a PED, or pigment epithelial detachment. You can see it looks abnormal on the B-scan, and the OCT angiography confirms the presence of a neovascular membrane. This patient has a normal OCT scan, and you can see that there is a normal choriocapillaris slab aside next to it. You can also use analytics to look at outer retinal disease, just like we did with inner retinal disease. You can measure the size of a choroidal neovascular membrane quantitatively using a flow area tool. Here's an example of a patient with AMD who had a history of dry disease, and he converted to the wet disease. When you look at the B scans on the bottom left, you can see that there is an area that looks suspicious on the top B scan image. OCT angiography confirmed the presence of a choroidal neovascular membrane. I hope that this small tutorial shows you the efficacy of OCT angiography and will help you to apply this excellent technology to your practices. Thank you for your attention today.